All right, folks, welcome back. Now, this is the CDC. We've been talking about these people for a while. They're ready to shake up amid obvious COVID mistakes. So our next guest was among the doctors ready to fight the virus in the early stages of the pandemic using science before the vaccine was available.
We're going to welcome in that guest, the author of The Courage to Face COVID-19, Preventing Hospitalization and Death While Battling the Biopharmaceutical Complex, Dr. Peter McCullough. Doctor, good morning. Welcome back.
Thanks for having me.
All right, let's start with this book, because you were one of the first people who were like, guys, let's take a step back. Let's look at some data, this pesky stuff we use in science, and say, hold on, what you're doing doesn't make sense. You were criticized heavily for that.
I was, but we found it implausible that this virus was the first, microbe that was unassailable. That we could always treat every infection to some degree. And when we saw large numbers of people being hospitalized and dying, we couldn't sit on the sidelines. Myself and others worked in groups all across the world to come up independently with ways of treating the patients early to avoid hospitalization and death. No drug was perfect, but we looked for signals of benefit and acceptable safety, used the drugs in combination, and were successful. Early on, we could reduce about 85% of the hospitalizations and deaths. And now with all the drugs we have in combination, fortunately, Americans are not being hospitalized with COVID-19, and they're certainly not dying of the illness with COVID pneumonia. We now have very good approaches. It's key to treat patients in the first 3 days of the illness.
What were those?
The drugs initially, we relied on hydroxychloroquine, aspirin, corticosteroids, nutraceuticals, particularly vitamin D. And then later on through the program, we relied on monoclonal antibodies heavily, virucidal nasal washes, ivermectin, and then Paxlovid and molnupiravir, inhaled steroids, again, oral steroids, colchicine. It all came together, about 4 to 6 drugs in combination. And when I review all the reports of people dying of COVID, it's because they didn't receive early treatment.
And a lot of the treatments you're mentioning are things that were criticized very early on in the pandemic. When it comes to the CDC's response and what you're mentioning, you said 85% saw a reduction. That's a huge amount. What could the CDC have done different?
The CDC clearly should have convened groups of doctors and commissioned an early treatment panel. The only way to avoid a hospitalization is to do something before the hospital. The CDC should have made that very fundamental observation that prevention of hospitalization and death in those who are acutely sick was the top priority. Instead, the CDC was perseverating over masking, lockdown, social distancing, and vaccines. None of those things helped the acutely sick patient.
Yeah, that was the interesting thing. It was like there was no measurable data to show that the mask mandates worked. The vaccines clearly did not stop the spread of infection. They, in some cases, they reduced the effects of the severity. But we're seeing people now, like Joe Biden and cabinet secretaries, like the Secretary of Defense, they're like quadruple vaxxed, and they're all getting COVID now. So, like, obviously, it doesn't have the efficacy that they sold the American public on. And then you had people like yourself, also Dr. Robert Malone, who's a colleague of yours, suing now the Washington Post for defamation because he said they offered misinformation about the vaccines and the Omicron variant. What are your thoughts on the fact that he's actually fighting back now?
He is, and I've joined a suit with him against Twitter. What we found is the media was complicit in propagating a false narrative, really propaganda, and it emanated out of the NIH, the CDC, and the FDA.
But out of the direction of the White House, too.
In the White House, yeah. So Americans deserved the truth. And when they didn't get it, instead of our government agencies coming clean and saying that the science is evolving, the virus is mutating, instead they doubled and quadrupled down on a false narrative.
Yeah. I don't think there's any issue with them coming out and saying that the virus has evolved, the recommendations are evolving, instead of what we did see, which was them doubling down on efforts for what they were currently doing, that 11-day quarantine, masking, shutting down, keeping people inside. But then you see people like Rochelle Walensky, who has a new goal for the institution, wanting to reform it after the original response. We also saw somebody else in the CDC say that they're in a stronger place, and that's why they're making these changes, even now suggesting taking 3 tests at home to confirm for sure that you are positive. What do you make of this, doctor?
I think confirmatory testing, given the importance of the diagnosis, should have always been done. PCR should have always been confirmed with antigen and vice versa. The CDC recommendations on using PCR at a low cycle threshold, less than 28, should have been followed. So not all the things the CDC did was bad, but the CDC traditionally is outbreak investigation, in vitro diagnostics, and data analytics. The CDC has never been positioned to make broad, sweeping, dictatorial recommendations for the nation, and what we found out is it was disaster.
Yeah. I mean, it's crazy to me, but they got to do something, because people like me, like, again, pretty average guy, is like, if the CDC tells me to do something, I'm probably going to tell them to pound sand at this point. So, yeah. So that to me is probably the most important thing that you can take away from this. So,
Doctor, before we let you go, we do want to ask, are we going to see a new variant emerge in fall, and should we be concerned?
The virus is still finding pockets of susceptibility. I think there still are susceptible populations out there across the globe. So I anticipate we will see more variants. Most Americans now have been through it. And so there is an umbrella of immunity that basically protects one from having hospitalization and death. So I think anybody who's had the illness now, a subsequent illness is indistinguishable from the common cold, and they can rest assured that their natural immunity will protect them.
Yeah, Dr. McCullough, always a pleasure, sir. We appreciate you being here.
Thank you.
All right, great new book, too. Pick it up if you can. All right, folks, don't go anywhere. We got plenty more to come on Wake Up America Weekend.